Hello, and welcome to the Congressional Hispanic Caucus Institute's 2022 Graduate Fellowship Program Capitol Hill Briefing Series. I'm Marco Davis, President and CEO of CHCI. This series is the culmination of CHCI's premier 9-month graduate fellowship program, which offers exceptional emerging Hispanic leaders unparalleled hands-on experience in public policy. This unique fellowship program seeks to enhance participants' leadership abilities, strengthen their professional skills, and increase the presence of Latinos in public policy areas, most notably in the areas of health, technology, housing, energy, social equity, child welfare, and education. CHCI is thrilled to be able to offer our graduate fellows the opportunity to share their perspectives on policy issues that they're passionate about and convene leaders in this work for an informative conversation. Now, we'd like to thank our Graduate Fellowship Program sponsors for supporting the program, including Facebook, the PepsiCo Foundation, America's Health Insurance Plans, BBVA, Casey Family Programs, the Walton Family Foundation, the American Petroleum Institute, DaVita, Wells Fargo, and CVS Health. You can keep today's conversation going by using the hashtag CHCI Fellows on social media. And please visit chci.org to learn more about our graduate fellowship program, as well as our other leadership programs and special events. And we encourage you to reach out to our fellows via LinkedIn to find out more about their policy work and help them connect with job opportunities for when the program concludes in May. Now let's get to the briefing. Enjoy the discussion.
Hello, my name is Caroline Gonzalez-Scott, Vice President of Programs at CHCI. Join me in welcoming Congressman Robert Bobby Scott from Virginia's 3rd Congressional District and Chairman of the House Committee on Education and Labor.
Good afternoon. I'm Congressman Bobby Scott, representing Virginia's 3rd District, and I chair the House Committee on Education and Labor. I'd like to thank the Congressional Hispanic Caucus Institute for inviting me today to be part of the 2022 Capitol Hill Policy Briefing Summit. Our nation's children have the right to be fed nutritious meals that support growth, development, and learning. And the long-term rippling effects of food insecurity makes it much harder for a child to succeed in life. So I'm committed to passing a comprehensive child nutrition reauthorization bill that will modernize, expand, and strengthen the federal child nutrition programs to ensure that children across the nation have access to and are fed high-quality, nutritious meals. Isabella has played and will continue to play an instrumental role in helping draft legislation for this reauthorization. Our committee has been extremely fortunate to have Isabella bring her perspective, not only as a CHCI graduate fellow, but also as a registered dietitian nutritionist. Throughout Isabella's studies as an undergraduate nutrition major at Montclair State University, she began to comprehend the complexities involved with food equity and the government's role in combating food insecurity. This led her to attend St. Elizabeth's University Graduate and Dietetic Internship Program to concentrate her education around community and public health nutrition. As a proud immigrant from Colombia, her perspective and lived experience as a former participant of child nutrition programs and her expertise as a dietitian are all absolutely valuable in the legislative work that she manages. So Isabella, thank you for your efforts to strengthen child nutrition programs, to ensure that children have access to nutritious food. And now it is my pleasure to welcome our moderator for this session, Isabella Baldrich.
Thank you, Chairman Scott, for that kind introduction. Your support for strong child nutrition legislation and efforts to get children fed across the country is really inspiring. Your commitment to providing evidence-based practices and policies through this upcoming child nutrition reauthorization will have a tremendous impact on children nationwide. As mentioned before, I am Isabella Baldrich, and I am the 2021-2022 CHCI PepsiCo Nutritional Health Graduate Fellow. I am honored to be here moderating today's conversation along with our distinguished panelists who are experts in health and nutrition. I would like to welcome and thank you all for attending the 2022 Congressional Hispanic Caucus Institute Policy Briefing Series. This session today is entitled The Effects of Food Insecurity on Child Development, a focus on Hispanic and Latino children living in the U.S. Before I begin, I would like to quickly mention that throughout this briefing, I will be using the terms Hispanic and Latino. This depends on the source where the information was published that uses either term. In the United States, most households are food secure, meaning that households have consistent, dependable access to enough food for an active, healthy living. On the other hand, food insecurity is when there is a disruption of food intake or eating patterns because of a lack of money or other resources. Food insecurity is not to be confused with hunger, which refers to the physiological response of discomfort, while food insecurity refers to having reliable access and resources to obtain food. Unfortunately, sometimes families are faced with having to choose between other expenses, such as housing or other utilities over food. Trade-offs occur when adults trade food quality for quantity as a way to prevent children from the physical sensation of hunger, which then often results in food that lacks nutrients. The latest statistics on food insecurity in the United States show that 14.8% of households with children were food insecure in 2020. Compared to food insecurity rates during the peak of the Great Recession in 2009, these statistics are actually significantly lower, as rates for that year were up to 21%. Latino children make up a quarter of the US child population and are the fastest growing child population. Among children with immigrant parents, more children live in low-income households compared to children with parents born in the US. Food insecurity risk and its health ramifications may also be exacerbated by migration, as parental immigration status and duration of residence also affects child health status. This in turn influences future economic opportunities and access to healthcare and public assistance programs. Food insecurity is influenced by several factors, and it's not limited to race, ethnicity, income, employment status, and disability. Racial and ethnic disparities are also more prevalent in Black and Hispanic households, with food insecurity rates being 2 times higher than the national average. These disparities exist because of a combination of factors, including systemic racism, racial discrimination, built environmental factors, and economic instability, among other factors that further contribute to food insecurity among communities of color. In 2019, 38% of children under the age of 18 lived in low-income households, and of those households, 53% were Latino children. As a registered dietitian nutritionist, it is my job to educate people on the importance of nutrition, especially for children who are growing and developing. Food insecurity can negatively impact and have irreversible consequences on a growing child. The cognitive impairments resulting from food insecurity have the potential to be the most destructive to young children since they are the most vulnerable to stressors. A weak foundation for learning, behavior, and health are consequences of an altered and weakened brain architecture due to stress and nutritional deficiencies. Consistent evidence shows improved health outcomes and dietary quality as a result of participation in child nutrition programs, which include the school meal programs. As Chairman Scott previously mentioned, through child nutrition reauthorization, Congress has the ability to modernize, strengthen, and expand these programs that directly combat child food insecurity so that children receive quality nutrition. In our efforts, we specifically have an opportunity to address health disparities and support racial equity through strong and innovative ways through this reauthorization process, as participation in school meal programs is the highest among Black and Hispanic children. I am excited for the enriching conversation we will have today, as we will hear the different perspectives from the panelists who represent a range of areas of expertise on this issue. At this time, I will introduce our 4 panelists. Starting off, we have Dr. Kimberly Montes. She is a certified Spanish-speaking bilingual Latina general pediatrician representing the American Academy of Pediatrics. She is an assistant professor of pediatrics, an associate program director for the Pediatric Residency Program, and an associate director at the Maya Angelou Center for Health Equity at the Wake Forest School of Medicine. Her research focuses on health disparities, including food insecurity, immigrant and refugee health, health equity, and community-engaged research. She has co-authored the Food Insecurity Toolkit for Pediatricians with the American Academy of Pediatrics and the Food Research and Action Center. Please join me in welcoming Dr. Montes to today's briefing.
Hello. Thank you, Isabella, for that introduction and for the opportunity to speak today. I'm Dr. Kimberly Montes, a pediatrician in Winston-Salem, North Carolina, and the Vice Chair for the American Academy, or AAP, Council on Community Pediatrics. And my remarks today are on behalf of the AAP, a nonprofit professional organization of 67,000 pediatricians. Even before the COVID-19 pandemic, 1 in 6 children lived in poverty, and nearly half of all children lived in low-income households. Poverty leads to hunger and food insecurity. This lack of consistent access to enough nutritious food has disproportionately affected Black and Latino families, as Isabella mentioned. For example, in 2020, 13% of households with Black children and 12.2% of households with Latino children experienced food insecurity, while only 4.2% of households with white children experience food insecurity. The Academy believes that we have a responsibility to dismantle racism at every level and eliminate disparities in the health and well-being of children to ensure they reach their full potential. This requires the root causes of health disparities to be addressed, including direct public policy action from policymakers. As pediatricians, we know firsthand the negative effects that food insecurity has on child and family health. Research shows that children who don't get enough to eat face higher risks of chronic health conditions, visit the emergency room more often, and have poor overall health. Children struggling to get enough to eat are also more likely to have problems in school and may have developmental delays and mental health problems. This is why in 2015, the AAP began recommending pediatricians screen families for food insecurity. Food insecurity can lurk anywhere, and now more than ever, it's critical that medical providers screen and intervene for food insecurity, as the COVID-19 pandemic has exacerbated the problem. With the growing recognition of the negative impact that food insecurity has on child and family health, the academic clinic that I work at in Winston-Salem, North Carolina, began addressing food insecurity 8 years ago. My clinic serves a patient population in which more than 92% have Medicaid insurance and predominantly self-identify as Black or Latino. We have seen a decrease in the food insecurity rates as we built our comprehensive food program, which is called Food is Health, in which we have a bilingual care navigator who meets with families, provides food from our on-site food pantry, a voucher to a farmer's market, a list of resources, and connections to the federal nutrition programs. There was a 5.5% drop in patients who screened positive for food insecurity over a 2-year period just before the pandemic hit as a result of our program. The desire to do something started after frequently hearing devastating patient stories, including a 3-year-old noted to be underweight during a well child visit at clinic. The child's mother could not read English and had difficulty accessing nutrition benefits to feed her family of 5. She also reported fear of using the federal benefits due to concern for deportation. Sadly, her story is not unusual in our community. In caring for our patients, we also see the positive impact that federal nutrition programs, including WIC, the National School Lunch and Breakfast Program, the Child and Adult Care Food Program, and the Summer Food Service Program have on reducing food insecurity and promoting access to healthy, nutritious foods. For example, at my clinic, we've developed a very close partnership with the WIC offices in 3 counties, and through a data sharing agreement have given WIC access to our electronic health record. We began screening all children under age 5 for participation in WIC, and we can now make direct referrals to WIC through our health record. And WIC has the opportunity to review medical charts and directly message pediatricians, which has the opportunity for cost savings in the long run. With the pandemic waivers, WIC has been able to enroll families on the same day as the pediatrician's referral, providing a lifeline to families. One of the most effective investments the federal government can make to reduce food insecurity and obesity in early childhood, improve birth outcomes, and support breastfeeding mothers is to increase access to WIC. While reasons for not enrolling in WIC vary from family to family, barriers that families face to enroll and remain enrolled in the program should be eliminated. As more families are left unable to afford healthy, nutritious meals at home, the importance of healthy school meals has taken on a new urgency. It's critical that we build on the progress made under the Healthy, Hunger-Free Kids Act to improve the nutritional quality of all foods available in schools, and so that they are aligned with the dietary guidelines for Americans and to provide schools with the resources they need to serve healthy meals. We appreciate USDA's focus on summer meals and hope that Congress will increase resources for it and expand access to summer feeding programs. Given how effective the pandemic EBT program has been, after the pandemic, this model should be used to ensure students have access to healthy meals during the summer months, on weekends, and during holidays. The AAP is committed to reducing the ongoing costs and burden of racism and health disparities to children, the healthcare system, and society. Given the long and short-term impacts of food insecurity on child's health, it's imperative to ensure that all children in this country have access to the critical supports provided through the USDA nutrition assistance programs. Food insecurity will not vanish as our lives return to a new normal. We are grateful for the investments Congress has made in child nutrition in the past COVID-19 relief packages, and we support the effort to reauthorize and strengthen these vital programs for children, which have the opportunity to reduce health disparities, particularly for Latino children. Thank you again for this opportunity to be here today, and I look forward to answering your questions.
Thank you, Dr. Montes. I am super grateful to have you join us today to provide the medical community's perspective on this issue. Now, I would like to introduce Dr. Angela Odems Young. Dr. Angela Odems Young is an associate professor for Cornell University's Division of Nutritional Sciences. She is the director of the Food and Nutrition Education in Communities program and New York State Expanded Food and Nutrition Education program. Dr. Odems Young's research explores the social and structural determinants of dietary behaviors and health-related outcomes in low-income populations and Black, Indigenous, and people of color. Her work also centers on developing culturally responsive programs and policies that promote health equity, food justice, and community resilience. Dr. Odems Young has over 20 years of experience partnering with communities to improve nutrition and health, and over 200 academic publications, book chapters, and presentations. Dr. Odems Young, the floor is yours.
Thank you so much, Isabella. It is really a pleasure to be here and have the opportunity to speak. To Chairperson and Congressman Robert Bobby Scott, as well as Senior Director Caroline Gonzalez Scott and other esteemed panelists, it really is a pleasure to share my experience in the field and also perspective on why child nutrition policies are so important. The COVID-19 pandemic and resulting economic fallout has caused significant hardship for individuals, families, and communities across the United States. However, rooted in longstanding structural inequities, including poverty, racial segregation, and discrimination, Latino and Hispanic, as well as other people of color, are disproportionately impacted socially, financially, and physically when it comes to the burden of this pandemic. The largest racialized minority group in the United States, the Latino population reached 62 million in 2020, and an increase of 23% over the previous decade that outpaced the nation's 7% overall population growth. The Latino population plays a significant role in the U.S. economy, accounting for 17% of the labor force. Often working several jobs to attain financial gains, evidence indicates that income and other social determinants of health, such as lack of access to jobs, inadequate transportation and wages, and inequities in assets and wealth contribute to the disproportionately high rates of food and nutrition insecurity among Latinos. COVID has really just exacerbated these long-standing health inequities that continue to affect Latino populations and other families of color. Hispanic populations were more likely to be hospitalized and die from COVID than non-Hispanic white Americans, with excess risks higher among younger age demographics. In addition to other risk factors such as greater exposure, people of color overall and Latino populations specifically face higher rates of certain diet-related chronic conditions as compared to whites, including hypertension, diabetes, and obesity. Risk factors for non-communicable diseases coupled with the decreased access to healthcare makes Latino populations disproportionately vulnerable to chronic disease and morbidity and mortality. Food and nutrition insecurity is an important issue for Latino youth and adults because of its association with inadequate nutrient intakes and underconsumption of healthy foods that put people more at risk for chronic conditions. Defined as access to enough food for active and healthy life, food insecure households have difficulty consistently obtaining adequate food for all household members because of limited economic resources. In 2020, more than 19% of Latinos in the United States were food insecure. Latinos are 2.5 times more likely to experience food insecurity as compared to whites, and Latino children were more than twice as likely to live in a food insecure household as compared to white children. If we think about a life course perspective, food insecurity in childhood can have lasting effects into adulthood on academic achievement, health, and income. And children who are food insecure are also at risk for other health conditions, such as injuries, and of course, more susceptible to chronic conditions and developmental delays. Food and nutrition insecurity is linked to poverty, and unfortunately, Latino children suffer from financial, social, and the physical impacts of this condition of poverty. Child poverty rates are more than twice as high for U.S. Latino children as compared to white children, and this really results in a higher prevalence of very low food insecurity, which is a more severe level of food insecurity, in which the food intake of one or more household members is reduced and normal eating patterns are disrupted. This was higher in Hispanic households as compared to U.S. households overall. And in 2020, as children age, more disparities surface. And this is really important when we look at food insecurity in early childhood. In comparison to parents of non-Hispanic white children, parents of Latino children reported significantly higher rates of fair to poor health among their children and a higher prevalence of overweight and obesity. I think what's particularly important to note is that although poverty disproportionately impacts Latinos and other people of color overall, you do see differences across the Hispanic or Latino population. For example, according to the U.S. Census Bureau, poverty rates ranged from as low as 16% for those of Cuban origin to a high of 26% of those of Dominican origin. Hispanics of Salvadorian origin had a poverty rate of 18.9%, and Hispanics with origins from Mexico, Guatemala, and Puerto Rico had rates around 25%. And this results in significant differences in health. For example, the rate of low birth weight infants is lower for the total Hispanic population overall, but Puerto Ricans have a low birth weight that's almost twice that of non-Hispanic whites. Strong federal nutrition programs are critical to reduce food and nutrition insecurity for Latino populations and other people of color during COVID and beyond. Yet many Latino families continue to experience barriers to program participation, including language, mistrust, immigration status, and residents in mixed status households, And these are particularly relevant when we look at the child nutrition programs as well as SNAP. The fact that Latino families may be eligible for federal nutrition programs but forego food assistance out of fear is extremely concerning. This is particularly evident when you think about certain programs as compared to others. But program participation not only helps individual families, but really can help society overall. And we've seen this, as my colleague mentioned, in the context of WIC, where over 40% of WIC participants are Latino and nearly 1/4 of National School Lunch Program children, participating children are Latino. Centering equity in food and nutrition programs is critical to advance societal health as well. So UNIDO's US had a survey that they conducted, and they found that during COVID, Latino communities had experienced higher rates of income insecurity, anxiety and fear, and access to health services, food insecurity, and lack of access to technology that needs to be addressed in policy. Children's physical and mental health provides a foundation for their education, employment, and long-term well-being as adults. So child nutrition programs such as WIC, the National School Lunch Program, are critical to meeting the nutrition needs of Latino children, but also supporting health and well-being across society. Culturally and linguistically appropriate outreach and education for federal nutrition programs is also important to address food insecurity. And given the importance of social determinants of health, improvements in children's health and nutrition require researchers, practitioners, and policymakers to think beyond only individual education, although nutrition education is extremely important, but to make infrastructure investments that promote health, including thinking about how food assistance programs are administered both in the US and Puerto Rico, and providing healthy school meals for all. Over the last 25 years, I've worked closely with Black, Latino, and low-income white families and communities across Illinois and across the US through, in Illinois, our state commission to end hunger, and through my research lab, the Nutrition, Obesity, and Health Equity Research Group. This has allowed me to see the barriers that communities face firsthand, and how important it is to center the voice of the lived experience of families and make sure they're reflected in current policy. Thank you so much for your time and consideration.
Thank you, Dr. Odems-Young, for your incredible work and service, and welcome to today's briefing. Next, I would like to introduce Sandra Adevalo. Sandra is a registered dietitian nutritionist and an independent consultant and director of community health and wellness at Montefiore Nyack Hospital. Her commitment is to provide health information and promote disease prevention among the most underserved and diverse families. With over 15 years of experience, she is a recognized national expert and speaker on diversity, health education, diabetes, nutrition, chronic diseases, and social determinants of health. Her work has been featured in national and international TV, numerous printed media outlets, radio, and peer-reviewed journals. She is a spokesperson for the Academy of Nutrition and Dietetics and the American Diabetes Care and Education Specialists. I am delighted to have her speaking at today's briefing as a fellow Colombiana and dietitian from my home state of New Jersey.
The Academy of Nutrition and Dietetics believes that healthy school meals for all is a critical strategy for educational and health outcomes for every student in America. School cafeterias are the healthiest place to eat for all students in the United States, and school meals provide a key support to low-income and students of color, helping to reduce racial disparities in both health and education. Academy members know that offering healthy school meals to all students at no cost to their families increases participation and reduces stigma, and that school meals support local economies through programs like Farm to School. Schools are on the front lines of emergency feeding, whether in a pandemic or during natural disasters. Students in the United States are provided with textbooks, transportation, and even high-end technology such as tablets and laptops, and yet an essential resource like a healthy school meal remains financially out of reach for some families. We have worked so hard, and we are so close. We can achieve healthy school meals for all, and the time is now.
I would like to introduce Sandra to today's briefing now.
Thank you so much, Isabella, for such a warm welcome. And thank you for having me here. So I'm representing the vision of more than 112,000 dietitians that are members of the Academy of Nutrition and Dietetics, which is the world's largest organization of food and nutrition professionals. Many of us are professionals, dietetic technicians, and we have advanced degrees, many of whom are providers working in the child nutrition programs. Whether it is a practitioner providing counseling services through week or planning menus for a school lunch and breakfast or conducting research on child health or working with local farmers, we as members are significantly impacted by policy related to the child nutrition program. The problem here is that the diets of most children continue to fall far short of recommendations for good health. 13 million children were estimated to have experienced food insecurity in 2021. At the same time, obesity rates that began rising in the 90s have led to 1 in 5 children in the US having overweight or obesity. Children from racial, ethnic, and low-income groups disproportionately experience high rates of food insecurity and nutrition-related chronic disease. On top of that, the COVID-19 pandemic disproportionately affected people with diet-related chronic disease, which are more prevalent in communities of color. Communities of color have historically faced chronic disease health disparities due to the systemic inequalities that have manifested in reduced access to health care, healthy food, and safe places to be active. It is more important now than ever to invest in the establishment of healthy eating habits throughout the life cycle. Nutrition education continues to be important to a school and to students. But with competing educational priorities, the unfunded requirements of the local wellness policy, and the consistent underfunding of current national nutrition education and promotion efforts, nutrition education has not been given adequate prioritization. After working for 15 years with underserved children and families in the most underserved neighborhood in the South Bronx in New York City, the poorest congressional district area, I can tell you that a strong nutrition standards work. The school meal nutrition standards significantly increase the dietary quality of both the lunch and breakfast program offerings, while healthy eating index scores for lunch and breakfast increased by 41% and 44% respectively. Schools are the healthiest place in the US to eat, according to recent studies. And after analyzing 16 years of American diets, researchers found that meals eating at schools had higher dietary value than meals eating anywhere else, even at home. School meals have proven crucial in alleviating childhood food insecurity amid the pandemic, in no small part because of waivers allowing schools to serve meals free of charge to all students regardless of their income level, in addition to being a key support in alleviating childhood food insecurity among students. School meals can also help reduce racial disparities in health and education. They can reduce childhood hunger, childhood overweight and obesity, improve childhood nutrition and wellness, enhance child development and school readiness, and support learning, attendance, and behavior. So I'm looking forward to talk to you more about all these beautiful programs that we can help support that can help alleviate the problem.
Thank you, Sandra, for bringing the dietitian's perspective to this conversation. And last but certainly not least, please welcome Dr. Allison Lacko, who is also from my home state of New Jersey. Allison is the Senior Nutrition Research and Policy Analyst at the Food Research and Action Center. She is responsible for providing research and analysis that support FRAC's advocacy to address the root causes of hunger and strengthen the federal nutrition programs. She also writes the Quarterly Research Wire, which is a newsletter highlighting the latest research on food insecurity in the U.S. Allison previously served in the Peace Corps in Costa Rica and worked for Zufall Health, which is a federally qualified health center in New Jersey. Take it away, Allison.
Thanks, Isabella, and thank you for the opportunity to speak on the panel today. My name is Allison, and like Isabella mentioned, I'm the Senior Nutrition Research Analyst at the Food Research and Action Center, or FRAC. And FRAC is a national nonprofit that works to improve the nutrition, health, and well-being of people struggling against poverty-related hunger in the U.S. through advocacy partnerships and bold and equitable policy solutions. So I'm really excited that all of my fellow panelists have been talking about the federal nutrition programs. Things like Healthy School Meals for All are certainly programs that FRAC is advocating hard for. We focus on access to healthy food with dignity. So as the senior research analyst, it's my job to analyze and integrate data trends around hunger, poverty, health, and equity to understand the evolving context and potential policy solutions around these issues. Given my work at FRAC, I'm going to briefly speak about the root causes of hunger, poverty, and health disparities in Latino communities. You heard from Isabella already how the economic and public health crises from COVID-19 have had disproportionate impacts in certain communities following pre-existing disparities in hunger, poverty, and health. And Dr. Odems Young gave an excellent analysis on how these disparities predate the pandemic and how they mutually enforce each other in a vicious cycle. We know that systemic racism shows up in housing, wealth, jobs, policing, education, and healthcare. While systemic racism permeates our whole society, it shows up differently for specific communities. So understanding how the root causes of these disparities differ by community is critical when we think about policy solutions. Because if we're going to get specific about solutions, we have to get specific about the causes. So for example, prior to COVID-19, Latino communities experienced increased discrimination from immigration enforcement and from the public charge rule in 2019, which created fear and distrust of government services. This fear and distrust had a chilling effect. It reduced participation in SNAP and other nutrition programs that many immigrants were eligible for and were essential for improving their health, nutrition, and well-being. Although the Biden administration permanently blocked this in March of 2021, earning back trust is a long process, and there are other barriers to address, including language access issues, complicated program rules, and inaccurate information from some media sources and even immigration attorneys. Systemic racism against Latinos goes all the way back, so much further back than the 2019 public charge rule, back to the seizure of land and resources from Mexicans in what is now the Southwest US and in Central and South American countries. There is a long history in this country of the immigration system limiting the rights and exploiting the labor of immigrants. Latino communities are targeted by ICE, whose activity has increased in recent years and who incorrectly detain US citizens as well. We know that the deportations of immigrants result in economic disadvantage and trauma among children, family members, and communities in the US. And we also know that increased local law enforcement carrying out federal immigration activity is associated with an increase in food insecurity. Fear of deportation, whether it be due to ICE or due to local police, reduces economic activity in communities and increases mistrust of health services and public agencies, which in turn results in lower enrollment in social services like SNAP that could alleviate poverty and food insecurity. The impact of these racist systems against Latinos is intergenerational. Quoting a report from Unidos, US, young people who have grown up witnessing policy systems that restrict, stigmatize, and ostracize their parents and their families are at risk of becoming citizen adults who are more wary of government, less civically active, distrustful of key civic institutions, and apathetic to and disconnected from critical national interests and endeavors. All families should have access to the federal nutrition programs and also feel comfortable and confident in accessing them. FRAC provides resources to help community organizations and program agencies provide accurate information on immigration-related issues that intersect with the ability to access the federal nutrition programs. We also advocate for policies and procedures to improve access for immigrant families to SNAP and other programs. All of my fellow panelists, like I mentioned, have done a fantastic job in their opening remarks, advocating for the federal nutrition programs and explaining how they are vital resources for children. At FRAC, we strongly advocate for healthy school meals for all, increased benefits in WIC for fruits and vegetables, and increased adequacy and access to the Supplemental Nutrition Assistant Program. Finally, addressing the root causes of hunger in Latino communities means reforming our immigration system so that it focuses on services and families rather than on deportation enforcement. Supporting immigrant rights is essential to addressing food insecurity and boosting health, economic security, and opportunity. Thank you, and I look forward to our discussion.
Thank you, Allison, for taking the time to join in on this discussion. It's a pleasure to have you on this panel. So at this point in the program, we are going to begin the question and answer session. I will start off by asking a few questions and then open it up to the audience to ask questions. Audience, please feel free to engage with any of the panelists and remember to direct each of your questions to a specific speaker in the format of a question for the sake of time. So let's start off with Dr. Montes. As a pediatrician who works with a predominantly Latino population, what direct effects of food insecurity do you see in your patient population, including any mental health, cognitive, or developmental issues? And what differences do you see, if any, between parental immigration status and duration of residence in the U.S. in terms of overall health?
Thank you for that question, Isabella. So food insecurity can impact individuals at really any age. It has differential effects on, as I mentioned in my opening remarks, across the lifespan, from pregnancy to older adults. Food insecurity is associated with worse overall health, impaired chronic disease management, worse outcomes, and increased cost of care. So for example, in pregnancy, food insecurity is associated with lower birth rates in newborns, higher rates of preterm birth, higher maternal stress and gestational weight gain. And in children, there are a number of physical health effects, including ones that I mentioned previously, such as overall health, dietary quality, iron deficiency, underweight, overweight, frequent infections, hospitalizations, and even leading to adult cardiovascular disease. To your specific question about mental and developmental outcomes in children with food insecurity, there are higher rates of depression, anxiety, toxic stress, even suicidal ideation in adolescence. In terms of developmental outcomes, we know that children who have food insecurity perform less well academically. They have developmental delays, lower cognitive indicators, sometimes dysregulated behavior, and then reduced academic achievement overall. And we also know that I did not provide a comprehensive list of all the adverse health outcomes, but there are lots of studies that have demonstrated a delay in seeking medical care for those who have food insecurity, sometimes foregoing medications to purchase food, and then higher levels of usage of acute care. This has led to an increase in healthcare costs. So for example, I live in North Carolina, and we spend an excess of $174 per person in healthcare dollars due to food insecurity, which translates to about $1.7 billion for our state alone in just 1 year. So again, significant increased cost. And to your second part of your question, Isabella, about the different outcomes based on parental immigration status and length of stay in the United States. I think Dr. Lacko described it perfectly in terms of the barriers to health for our Latino immigrant population. I will say that there is something called the Immigrant Paradox, which is essentially the observation that recent immigrants often outperform more established immigrants and non-immigrants on a number of health, education, and conduct and crime-related outcomes, despite the numerous barriers they face to successful social integration. However, as they progress in time in living in the United States, they then begin to to reflect similar health outcomes to U.S.-born individuals and often take on those chronic health diseases. So again, as Dr. Lacko mentioned in her excellent opening remarks, I think sort of reforms to the immigration system and supporting our immigrant families is extremely important and can affect overall health outcomes from the lifespan from infancy to adulthood. Thank you.
Thank you, Dr. Montes, for highlighting the difference between overall health in Latino families when immigration and duration of residence comes into play. Now I would like to take a deep dive on the importance of overall nutrition. So this is for Sandra. The first 1,000 days of life, which is the time between when a woman conceives and a child's second birthday, is the most critical and vulnerable time for a human. Sandra, what role does nutrition play in growth and development? And how does a lack of nutrition affect normal growth and development during pregnancy, childhood, and adolescence?
Well, as we all know, when we talk about healthy eating, we talk about strength, growth, wellness. So nutrition is definitely the basis of what a human being best potential can be. So, a person, and let's start with a mom. If a mom who's pregnant is not eating well, the outcome, the baby, is not going to be well neither, either because of obesity or because low weight. Anyway, if the diet is not optimal, the baby is going to suffer the consequences. Now, there are studies that show that the consequences don't even have to show immediately, meaning at birth. There are consequences very long term that are, mental and physical. So these are kids that are not going to perform as well in schools later on. Then when the baby is born, we have this magnificent food that is breast milk. And as a lactation consultant, I am also an advocate. And then, there are so many mothers that don't offer breast milk to their children. And breast milk is the best that an infant can have. We say it's the first vaccine. It has antibodies. It has everything that the baby needs. So we also need to support breastfeeding and, help moms to breastfeed and show all that support so that these babies can also develop and be healthier. Then at around 6 months of age, when we are going to start offering some of the solid foods, moms need education around how to do this. We just feel that because we can't give birth, we automatically know how to handle the baby. And that's not necessarily so. Nutrition education is really very important because we can actually help mothers help their babies achieve their full potential. And then as they grow, we follow those same steps. We need to be with mothers every step of the way just to make sure that all the children are healthy. Then when they reach adolescence, for example, then there are other nutrition needs that come along, like women, for example, like girls, they start with their periods, so they need more iron, they need more calcium. We need to be aware of all these changes so that we are able to provide all the nutrition that we need through the life cycle, which is constantly changing. The number of calories that we need to eat changes, the micronutrients, the macronutrients, and that's the only way how we can achieve full potential.
Thank you, Sandra. And as you just mentioned, nutrition is vital during the early stages of life and all throughout adolescence. And this leads us to our next topic around access to food for communities of color. Dr. Odems Young, your work and research revolves much around understanding the social determinants of health and how that affects an individual's dietary behavior and health outcomes. Can you please explain what the social determinants of health are and how it relates to food security, specifically in communities of color? In your opinion, how are higher food insecurity rates perpetuated in these communities?
Thank you so much, Isabella. So when we think about the social determinants of health, the social determinants of health are really where we live, we work, we play, we worship. And the social determinants of health are impacted by the structural determinants of health. So how in society is power distributed? when we think about the idea of rights and policies that are kind of embedded in the fabric of our society, those structures can limit resources or they can give people access to more resources. So people need resources to eat healthy. Food insecurity, they need some resources, and those resources can come in different ways. Those resources can come through food assistance, they can come through employment, they can come through, as Sandra mentioned, the idea of resources. Nutrition education in itself is a resource. So we can have tangible resources, and we can also have economic resources, and social networks are also resources. So if we think about the social determinants of health, that context matters, and that's really guided by these structures. And so there's an extensive body of research that links the social determinants of health to poor dietary outcomes. We think about other societal things. We talked about racial segregation, as well as discrimination and racism, lack of education, all of those things, lack of social capital can play a big role when we think about outcomes such as poor diet or food insecurity. And so how do we change social and social context as well as structures?
Thank you for providing the context around the social determinants of health. And yeah, some communities face significantly more barriers and challenges. One thing I certainly want to explore now is the government's role in all of this. Dr. Lacko, what role does the government play in alleviating child food insecurity through nutrition assistance programs? And how do these programs target vulnerable children and communities?
Thanks for such a great question. So there are a variety of federal nutrition programs, and most of them have impacts that are beneficial for children. The programs that directly impact children are the Child Care Food Program, CACFP, the Supplemental Nutrition Assistance Program for Women, Infants, and Children, or WIC, and school meals, so school breakfast and the National School Lunch Program. The Child Food Care Program supports and provides reimbursement for healthy meals and snacks in childcare. And WIC offers pregnant women and new mothers, infants, and children up to 5 years of healthy foods and nutrition education. Both of those two programs reduce food insecurity and result in healthier meals, snacks, and overall dietary quality. And for WIC, this is especially true if infants stay enrolled through early childhood. So the longer that you're enrolled in WIC, the healthier your diet quality is. And it's also a program that's proven to reduce racial and ethnic disparities in poor infant health outcomes. School meals are also profoundly important. They reduce food insecurity and poverty, and they provide students with the nutrition that they need for growth, development, learning, and overall health. They're also linked with improvements in the classroom. Students have better attendance, academic performance, and academic achievements if they participate in school meals. The SNAP, the Supplemental Nutrition Assistance Program, is not specific to children, but many families do also benefit from this program. And participation in SNAP in early childhood has also been linked to improved outcomes later in life as adults. So higher educational achievement, higher paying jobs, that sort of thing. So all of these programs have really important benefits for children, and also equitable impacts. Like I mentioned before, there are several ways that we think the efficacy of these programs can be improved. So we've tested and we've learned a lot from what's happened during the pandemic in terms of improving these government nutrition programs. Free school meals were offered to students from the beginning of the pandemic through school year 2021 to 2022. And healthy school meals for all should be passed nationwide. Having universal access to meals, it normalizes participation in school meals, so it reduces stigma. And it also makes nutritious meals accessible to children whose families might be just above the income qualification, but still struggling to make ends meet. In addition, we also gave families benefits to replace school meals through pandemic electronic benefits, or PEBT. That has been shown to reduce rates of food insecurity among families, and that should be made available to students when they're not in school over the summer. Other COVID expansions, we increased the benefits for fruits and vegetables in WIC, and also improved access to obtaining WIC through allowing parents to complete enrollments and obtain services over the phone. Those should also be made permanent, as well as increasing eligibility for SNAP for college students, adults without children, and those who have formerly been convicted of a drug-related felony. All of those expansions would increase the equity impact of these programs. And I'm going to share a couple of advocacy tools for the kinds of things that we're advocating for going forward to strengthen even further the impact of these programs on reducing food insecurity among children.
Thank you, Allison. I appreciate your insight on this important question, and I certainly want to keep this conversation going around nutrition assistance programs. So the next question to any of the panelists is, what barriers do Latino families face when accessing nutrition assistance programs?
I can say that transportation is a big barrier because obviously, they have to fill out all these forms and they have to go to offices to apply for programs, and transportation might be an issue, maybe not in the big cities, but definitely in some rural areas especially. And then I will call discrimination as a barrier as well, because especially for Latinos, believe it or not, Latinos are very proud. And the fact that you have to go and seek assistance, it's a shame for a lot of people. And especially when you go to an office and you have to fill out paperwork, and if the paperwork is not in Spanish and your English is not very good, and you have to talk to people and ask for help, that's even more, it makes it harder to access all these services. So trust me, families think about accessing services twice because they don't want to go there, they don't want to ask questions, they don't want to feel discriminated, they don't want to feel that that they need the help, and they wish they could survive without the services, and it's not the case.
Thank you, Sandra. Any of the other panelists would like to join in? Go ahead.
I agree with Sandra. I also wanted to highlight Dr. Lack public charge and the change that it had. In addition to what Sandra mentioned, I think the legislation of the public charge significantly impacted the fear around using public benefits, in addition to the stigma that already exists. I think there was a lot of confusion, intentionally so, by that legislation that resulted in many families, even if they qualified, being confused about whether they should use them or not, and therefore are have been less likely to use WIC and SNAP, for example. So I think that legislation had an unfortunate impact on the Latino community.
Yes, thank you, Dr. Montes. Allison, would you like to add anything?
Yeah, I just wanted to add, building off of that the barriers that come from this kind of like fear and distrust that's so through the immigration system is mutually reinforcing with all of these other barriers that manifest through structural racism. So when structural racism acts through the immigration system, it doesn't only impact immigrants. ICE and policing result in discriminatory practices that impact anyone who looks like they're Latino, regardless of their immigration status. Isabella, in your brief about this topic, you talked about disparate rates of incarceration among Latino youth, so it impacts your interaction with the criminal justice system. And we know that these practices impact the emotional and economic well-being of entire communities and just perpetuate the cycle of distrust. So I just wanted to speak to that mutually reinforcing dynamic. And then specifically with public charge, we found at FRAC that did significantly have a chilling effect on enrollment in these nutrition programs, and other institutions have found that have found that through their own research as well.
Yeah, thank you, Allison. And I think some major points were just highlighted and touched upon, and it's important to keep this conversation going because work certainly needs to be done to make these programs more equitable to reach more children and families. And that is regardless of immigration status. These comments made by the panelists are a perfect segue for my final question, and that is, how can we ensure equity across the federal food and nutrition programs? I'd like to start off, Dr. Odems-Young.
Yeah, I think it's important. And I was going to just make one brief comment as it relates to the, which is kind of more of a boots on the ground, because one thing that we need to do is make sure we have trusted messengers in communities and that we have a diverse workforce when it comes to both a healthcare workforce, dietetic nutrition workforce, food assistance outreach, that we have models that are culturally and linguistically appropriate. But that's a complement to policy because things have to be multi-level. So we think about policies that don't discriminate or stigmatize, policies that don't restrict. So we have some policies where nutrition programs are restricted, they require certain documentation. So those things can be a deterrent to participation, but we also need those trusted messengers within communities to connect with people, educate, and inform. I think WIC is such a great example of I'm a big fan of WIC, of course, but I think WIC is a really good example and historically has been a good example when it comes to participation of birthing parents and improving the health of low-income children.
Thank you, Dr. Odems-Young. So at this point in the briefing, I would like to move on to the audience Q&A. So this question is from Amaris. The connections between nutrition and education are very telling. For any panelist, what advice would you have for educators who notice their students are struggling with food insecurity?
You know, as a nutrition educator, I insist in nutrition education. And, you know, I think that it's time that we start educating families about the difference between food quantity and food quality as well. Unfortunately, you know, the less resources a family has, the more less quality food the family buys. And, you know, a lot of children, they are eating junk food and food that is not healthy for them and doesn't let them concentrate and have the ability to perform well in a school. So I think the families also need to learn, you know, that quantity is not the most important. What really matters is the quality of food. And I think that happens also with the school food program and the breakfast program, you know, where people complain that the food is not enough, but they're not looking at the quality of the food. You know, when we think about hunger and resolving hunger, we think about stuffing ourselves, which is not necessarily a solution. What we really need to do is to start eating healthier. You know, the portions don't need to be that big, and families need to learn about that as well. So if I were a teacher in a school and I see that my children are hungry, I would like to know what they're eating. And I would like to give advice to the mothers as what can be healthier for them. You know, maybe if they eat sweets in the morning, you know, it will be better to just have a yogurt or something a lot more nutritious. And with that, you know, we're not only helping the kids have better nutrition and perform better in a school, but we're also, you know, helping families save money and, you know, improve the academic achievements of the children.
Thank you, Sandra. Allison, would you like to share your thoughts?
Yeah, I think like any, so schools are a really good touch point to refer children to the federal nutrition programs. Dr. Montes talked about the healthcare setting. Schools are another good setting where it's, you know, going above and beyond noticing if a child is experiencing food insecurity. The next step is to really connect them with programs that we know work at alleviating food insecurity.
Thank you, Allison. And our final question from the audience, from Fatima. Is it important to ensure children receive quality, nutritious foods that are representative of their culture? Dr. Montes, if you would like to start off.
Well, sure. In short, I can say yes. As a pediatrician, we talk about culturally effective care. And part of that is recognizing that culture plays into health significantly. And so recognizing and understanding others' cultures through culturally effective education and care is important. And that includes dietary nutritious foods that are part of one's culture. And I think also cultural preservation, particularly for immigrants and refugees who come from other cultures and other countries, to ensure that that cultural pride is considered in that. So yes, I would agree. I think it is important to ensure that children receive quality nutritious foods. And so that's part of the nutrition education that Sandra mentioned. It's also part of ensuring equity across the federal nutrition program. So ensuring that there are culturally effective and appropriate foods for each of the populations, and that choice is an option in those food packages.
Thank you, Dr. Montes. Angela, would you like to say anything to this question?
Yeah, I think Dr. Montes really hit it right on with the cultural preservation, because when you look at culture, culture is not just a practice, it is really a value, it's a belief, and it's the way that you communicate values to the next generation. Traditionally, if you look at indigenous culture, African culture, the idea of how you are resilient, you teach resilience in the face of trauma. And when you face structural oppression, foods and that dietary preservation can really help with not only just good health, as I think Sandra mentioned so beautifully about the idea of eating well, but it also restores that identity that you have. And that identity is really important and with communities that face structural oppression and discrimination.
Thank you, Angela. So thank you to the audience for those well thought out questions. This conversation has been very engaging. Each of the panelists today have given their unique perspective on how food insecurity may affect a child. As we wrap up this session, I would like to ask each panelist to give their closing thoughts and final takeaways. Let's start off with Dr. Montes. If you would have our audience take away only one thing from today's panel, what would that be?
Wow, distilling into one thing is hard. I would say recognizing the signs of hunger for those who work with kids is important. That includes the educational system, the healthcare system, to recognize what those signs look like and to be able to intervene when one sees that. And so that includes, as I mentioned, behavioral considerations. If a child seems to be acting up, just consider that they may actually be hungry, and they may not have attention problems or behavioral problems. It just be something as simple as they're hungry. So recognizing that, I think, is first and foremost very important. And then secondly, intervening on that and connecting them as much as possible with nutritious, healthy food, which are the federal nutrition programs, and for policymakers to continue to strengthen those programs that we know are very effective at mitigating insecurity and promoting health among children.
Thank you, Dr. Montes. Angela, what is your takeaway from today?
Yes, hard to just think of one thing, but it's so important for us to think beyond the individual and think about, although individuals are important, families are important, and we can make sure that our institutions locally support those families through direct service. But we have to have policies in place to make sure that those direct services really yield results and that are community and culturally responsive. And so many times we think about one and we need to think about many. We think about our local community, but we need to think about population health. And so it's important that we address those social and structural determinants while we're supporting families and organizing at the local level, because really they go hand in hand.
Thank you, Angela. Sandra, what is your takeaway from today? Oh, you're muted.
Thank you. It's hard to follow what has already been said because that's exactly what I have in mind. But, I also have to add that we not only need to support all these federal programs, which are really great and proven effective, all these programs need to be followed with nutrition education that is also culturally sensitive, and that we need to reduce the stigma around the programs so that more families may take advantage of the programs and access them.
Thank you, Sandra. And lastly, Allison, what is your takeaway?
Yes to everything. Yes to the multi-level approach and to reducing stigma and to everything that my fellow panelists have said. I would add that we have to make sure that we're applying an equity lens to all of the work that we do to strengthen these programs, and really centering the experiences of people from specific communities, like considering the unique sort of context that's important for the Latino community. So Dr. Odems Young talked about making sure that people have a seat at the table, participants in these programs. The Center for Healthcare Strategies put together a great report saying hunger and incorporating with lived expertise. And there are things that we can do in the programs right now without having to pass legislation that also increase the equity impact of the program. So really thinking about all of this through an equity lens and not just as in making these programs stronger.
Thank you, Allison, for those closing remarks. So thank you so much to our distinguished panelists for sharing their expertise, the audience for attending and engaging with us, and for CHCI for hosting today's policy briefing and for allowing a space to discuss this critical issue affecting our nation's children. This issue is not just an immediate problem, but truly an ongoing long-term loss of educational attainment, workforce readiness, and also a driver of diet-related chronic diseases in Black and Latino communities. The barriers present across generations impact the next generation's human capital accumulation that includes education, skills, and health. The disproportionate rate of low-income, food-insecure Black and Latino communities is not by coincidence, but rather systematic exclusion dating centuries ago that still has present-day implications. Looking back at this discussion, it is clear that proper nutrition plays a significant role in growth and development throughout a person's life. Directly combating child food insecurity through federal nutrition assistance programs is a vital safety net for millions of children, but we cannot forget the powerful effects of addressing the underlying reasons behind food insecurity, like the social, environmental, and economic reasons, so that food and health are not compromised. Audience, continuing this conversation and informing others is a great place to start to help make a difference. Investing in future generations through comprehensive legislation is the ultimate goal to drastically reduce child food insecurity rates. Once again, thank you for attending this session, and don't forget to tune in tomorrow to watch the rest of my cohort continue the conversation around health. Have a great day, everyone.